purpose of this video presentation is to inform you about arthroscopy and arthroscopic surgery, its benefits and risks and potential complications.
You will now see a video that contains information you need to know for your knee arthroscopy.
This is an arthroscope. It is an instrument that allows us to look directly into the knee joint. The main advantage of arthroscopy is that quick and accurate information can be obtained. Many problems can be corrected at the same time using arthroscopic surgery. Only small incisions are required. The procedure is usually performed on an outpatient basis. Complications are very infrequent. We must remember that not all conditions can be helped using arthroscopic surgery. This is especially true if the knee has arthritis or other degenerative changes. As with any surgical procedure, there can be complications with arthroscopy. However, the incidence is fairly low. The risk of infection is less than 1%. The incidence of clinically significant phlebitis or blood clots in the leg is in the same range. Other problems, such as instrument breakage, anesthesia complications, or artery and nerve injury are rare but can occur. There are other potential complications that are even more infrequent. Precautions are taken to help prevent all complications, but we must remember that they can occur in spite of all safeguards. We must weigh the risks against the potential benefits and alternatives in making a decision about having arthroscopy. There are several other diagnostic methods, such as MRI, that might be ordered prior to your arthroscopy if needed. Arthroscopy can be performed under local, spinal, or general anesthesia. General anesthesia, in which you are put to sleep, is most common because it allows the joint to be relaxed so there is adequate room to work safely. You will need to have some lab tests done prior to surgery, such as a blood count and maybe a cardiogram. If the arthroscopy will be done at a future time, you can have the tests done at your local hospital or doctor's office and have the results sent to us at least 3 business days before the procedure. Some insurance carriers require a second opinion prior to approving elective surgery. You should check with your insurance company and be sure you have approval. You should also check to see if you need a referral from your primary care physician. Prior to the procedure, you should start washing the area several times a day with soap and water. You do not have to shave the area. We will do that when you arrive. Please remember that the skin has to be perfect. You can't have any scratches, pimples, sunburn, or poison ivy. Please check with the doctor's office the day before the procedure for final instructions. It is most important for you to remember not to eat or drink after midnight the day before the arthroscopy or the day of the procedure. If you are having a procedure under a local anesthesia, this is not important. You might want to put a reminder on your bathroom mirror so you don't forget to avoid drinking water in the morning. The arthroscopy will be done either at the MGH Surgical Daycare Center on the 3rd floor of the Wang Ambulatory Care Center or at the MGH West Outpatient Surgery Center in Waltham. MGH West is conveniently located right off Route 128. Now let's look at what you will do on the day of arthroscopy. In the preoperative area, an anesthesiologist will take your medical history. The anesthesiologist will explain to you the benefits as well as the risks and potential complications of the different types of anesthesia. You will then be taken into the operating room. During the procedure, the arthroscope is put into the joint through a small incision. A television camera is connected to the arthroscope, and a view of the inside of the joint is projected on a television monitor. The doctor moves the arthroscope throughout the joint and makes a diagnosis of the problem. If the problem can be corrected, the doctor will make another small incision and introduce operating instruments into the joint. Sometimes several openings are needed. The doctor watches the television screen so he can see what he is doing inside the joint. When you wake up in the recovery room, you'll be drowsy and should not have much pain. However, the Novocaine will wear off several hours later and the knee will be painful. If you have had general anesthesia or sedation, someone will have to pick you up to bring you home from the hospital. You can unwrap the dressing when you get home and apply ice directly to the joint. Change the Band-Aids whenever you like. You can walk on the leg, but this will be painful in the first few days. You can wash or shower starting 2 days after the procedure. Unless otherwise instructed by your doctor, take 1 or 2 aspirin tablets a day for 1 week, as this helps prevent phlebitis or blood clots. Call your doctor's office to make an appointment for a follow-up visit about a week to 10 days after the arthroscopy. Call Call your doctor if you experience problems following the arthroscopy, especially if you have excess pain or swelling, fever, or redness of the operative area. Call if you have other problems or signs of complications. Following the arthroscopy, you should do isometric exercises. These are quadriceps setting exercises during which you tighten the thigh muscle and perform straight leg raising exercises. Tighten the muscles and lift the leg up. You should try to do 20 or 30 every hour. You can bend the knee, but avoid sitting for long periods of time for the first few days.
If you have any questions at all, we will be happy to answer them. Remember, you should have nothing to eat or drink before surgery, and be sure the skin is clean.